welcome back once again. So, well, that was an intense chest workout, and well, once again, you really need to check with an expert before you start on any kind of extreme intense exercise. And it's always a good idea to be having a fitness trainer helping you out and assisting you as you are trying and embarking onto new things in the gym. But for the moment, well, we are embarking onto something very new, which is about the LASIK surgeries. So, well, LASIK surgeries have been going on for decades, but we get to see that they continue to be easier and more enhanced now. So, joining us here in the program is Dr. Mohammad Aslam Jan. He's a consultant ophthalmologist and an expert refractive surgeon. He's going to be speaking to us about LASIK surgeries. Assalamu alaikum, and a very good morning to you, Dr. Islam, and thank you for joining us.
Good morning. Thank you very much.
So, Dr. Islam, as we speak about any of the complications, any of the conditions that we may face, due to which we would need an expert like yourself, first tell us a little bit about our everyday life. Now, for us, let's say now in this modern day and time, we are glued to the screens almost 24/7. So in terms of our vision in general, an average millennial in particular, at least 15 hours a day on and off, he is exposed to his cellular device or his smart tab. So tell us, I mean, does it take a toll on your vision in general?
Yeah, I mean, it was considering before that, you know, reading while you are lying or reading in the dim light, it does not affect your vision. But nowadays, the concepts are changing now. And still, we have to ask our children to read in a proper light, and while reading, they have to sit. And especially, you know, in the elder age or in the young age, we have to take care about our neck movements also, you know, because all the time our neck is down, and most of the time we are walking, we are driving, we are also using and cellular phones also. So of course, the more we are exposed to and we are more glued to those screens, they definitely affects vision. And if we are not aware of our any refractive error or the changes, let's say if a person who need a glasses and he is not aware, and without using or correction of his vision with the glasses or by any means, and if he is using more and more these type of gadget, so of course there is a chances for increasing more and more you know, changes in the refractive error.
Right, because I think all of us grew up in households where grandparents or parents would tell you, oh, you can't, because you know, my favorite time of the day, as I was here all my life in Saudi Arabia, and growing up as a child, we used to have in the late afternoon special cartoons that used to come on channel 2, and that was something we would wait for all day. So we'd be sitting very close to the television, and I always hear from my grandparents that you are gonna affect your vision. And I grew up with that belief. I'm sure you did too, Ibrahim.
Yeah, that's true actually. And as you can see, I'm wearing glasses now. That's because I'm always glued to the screen, unfortunately.
Is it true, by the way, if you watch television from very close, that your eyesight would get affected?
One thing I must, you know, mention here, nowadays, you know, in the modern world, before admitting the kids to the school, it is mandatory to have few examination, like your eye examination, eye should be tested, your hearing should be tested, your teeth should be examined, or there are certain disease which can be corrected before certain age, like the amblyopia is a lazy eye. If we leave the child with unfortunately having a difference in the refraction between both eyes, so if the one eye is weaker and if we did not correct it till the age of 7 or 9 years, it's a whole life problem. You know, there is no
becomes a terminal problem.
Become the permanent problem. So this is one thing we have to get our children be tested before admission to the school. And for the healthy individuals, once a year examination is mandatory. Once you cross 40, it is also like mandatory to have an eye exam once a year. If you are healthy, then the only problem you will be encountering is just a dryness, you know. The more use of television or the computer or the telephone can only cause you the dryness, but once your vision is stable, it doesn't get much, you know, changes for the use of the gauge. But for the children, if they are not wearing glasses and if they are using those, you know, laptops or iPads, yes, there is a chances of increasing the power if they are not using the glasses.
Okay, so if you could just tell us, doctor, what could LASIK treat? What kind of problems can it treat, and who are the best candidates for the operation?
Okay. Before, you know, what is a LASIK and what we do that, it is good to have a knowledge that how our eye works, you know. Our eye works like a camera. The light rays enter into the eye and passes through the cornea and the lens, and it is focused on the retina. So the most focusing power, the 70% of the focusing power is coming from the cornea, and the 30% power is coming from the lens. Now what happened, you know, emetropia means a normal eye, all the rays are focusing on the retina, and from the retina it is passing through the optic nerve and going to the brain. So the ametropia is a refractive error, like myopia is the short-sightedness, hypermetropia is the far-sightedness, and there is another refractive error called astigmatism. In this case, what happened, like in myopia, the shape of the cornea is more steep, you know. So the focusing is more than the normal, and the image is forming in front of the retina. What happened in the hyperopia, the cornea is little bit more flatter. So the focusing is less and the image is forming behind the retina. And what happened in astigmatism, the corneal surface is not smooth, it's like wavy. So instead of forming a one focus, maybe two focuses are forming in front or behind the cornea. So what we do by correcting these refractive error by means of LASIK or any refractive surgery, we reshape the surface of the cornea. We reshape and make it accordingly to the individual, so the light should be focused on the retina. Like in the LASIK, what we basically do that is a laser assisted in situ keratomileusis, that we make a thin flap of the cornea, we lift the flap, we reshape the cornea by excimer laser, and we put the flap back. This is the whole surgery of the LASIK.
Right. So, Dr. Aslam, we are going to speak to you more about LASIK surgeries and as well as how non-invasive or minimally invasive they have become nowadays, and if it could be an outpatient procedure as well. But for the moment, we are going to embark on towards this quick report so that our viewers get to have a little bit more understanding of what we are talking about, and then we're going to be getting back with our discussion. Stay tuned.
While looking around, a normal eye can see all objects over a wide range of distances from 25 cm to infinity. But due to certain abnormalities, an eye is unable to see objects over such a wide range of distances, and such eyes suffer from defect of vision. Some of the most common defects of vision are farsightedness, short-sightedness, astigmatism, and presbyopia. Farsightedness is also called hypermetropia. In this type of defect, a person sees near objects blurred, while distant objects appear sharp. The person suffering from farsightedness has either thinner eye lens or shorter eyeball. Thus, the rays of light from the nearby object cannot focus at the retina to give a distinct image. The image is formed behind the retina. This defect can be corrected by using a convex lens of appropriate focal length. The convex lenses help to change the way light rays enter into the eyes and bend after refraction through the eye lens to form an image at the retina. Short-sightedness is a type of eye defect in which the person sees near objects clearly while distant objects appear blurred. It is also called myopia. The person suffering from short-sightedness has either thicker eye lens or elongated eyeball. Thus, a short-sighted person cannot focus clearly on an object farther away than the far point. In such a defective eye, the image of a distant object is formed in front of the retina and not at the retina. This defect can be corrected by using a concave lens. A concave lens of appropriate power or focal length is able to bring the image of the object at the retina itself. Astigmatism is an optical defect in which vision is blurred. It is usually congenital, but it can result from an injury. In this case, the cornea or lens is imperfectly shaped, just like a rugby football with two regular radii, one smaller than the other one. Thus, the eye is unable to focus a point object into a sharp focused image at the retina. It is corrected by using cylindrical lenses. Presbyopia is an optical defect which arises with advancing age. With aging, the natural lens of the eye becomes harder and less elastic. Thus, the ability of accommodation of eye gradually decreases and the person cannot see near print and objects clearly. This defect is rectified by using bifocal lenses and then can see clearly at all distances.
And welcome back, our dear viewers. On the subject of ophthalmology and the eyesight, we do have here Dr. Mohammad Aslam Jan, who's going to tell us more about the LASIK operations and the risks as well and the benefits of such operations. So if we could continue our talk, Dr.
All right, thank you very much. Before we were talking about the procedure, how we perform surgery on the cornea. A lot of people are coming and asking that you will do a laser or you will do a LASIK. This is like a most common question I used to hear in my clinic. So the laser by which we ablate or reshape the cornea is only a one laser, which is called excimer laser. But the modalities of the treatment, how we cut a cornea or how we make a flap, it's a little bit different. Like in PRK, photorefractive keratectomy, we use a handheld knife. We used to make a flap or we remove the surface of the epithelium by handheld knife. Like in LASIK, it is another procedure, another modality of the treatment, which is called laser assisted subepithelial keratomylosis, in which also we use the handheld knife. In LASIK procedure, we use a motor knife, it's called microkeratome. With that microkeratome, we make a cut and make a flap. This is called LASIK. With another advanced laser, which is called femtosecond laser, this laser only make a flap, a very thin flap. This is called intralace. So at the end of the flap, we use the same laser, excimer laser. The only difference is how we make a cut. And
so it's minimally invasive in a way, right?
yeah, I mean, you
That
can
there's going to be
say
a cut on the cornea and then the laser.
you can say that, yeah, yeah. But it's still, we have to make a flap in almost this all procedure, like a LASIK and intralace.
Right, and then what we saw during our report is what happens that there is a cut and then there is a light entering that is supposedly the laser.
It's like outpatient procedure,
So it
daycare
doesn't take
surgery.
a long time.
Yeah, it doesn't take. Patient is coming. We make him lie down under the machine, and there is a target light. We ask the patient to look into that target light, and we throw some pulses for the laser to reshape it, and it takes about few seconds to reshape the cornea. The whole procedure for both eyes is almost like 15 or 20 minutes.
So
yeah.
let's say if Ibrahim decides today to be the day for doing the LASIK, he could be just walking into your clinic today, like after
And
finishing
to
the program.
get rid of the glasses.
And it takes like 15 to 20 minutes and he could be driving back home, could he? Or is it like you have to be careful and you cannot drive or you cannot expose your phone to cellular light or what?
All right, he's more than welcome anytime.
Who are the people who can? As in,
Yeah.
what are you going to be
right.
finding out?
Okay. The people who are wearing contact lenses or the glasses for condition like myopia, hyperopia, or astigmatism,
Yeah.
people who are athletes, sports,
Yeah.
like swimmers, surfers, people who want to join some professions like army, they want to go like in aviation.
Right.
So there are certain jobs which required, you have
Perfect
to be
vision.
with
and
that
who are the
perfect
people
vision.
who are not able to do it? Let's say a person with high blood pressure or uncontrolled diabetes, or who are the people who cannot do it?
Okay. There is no absolute like contraindication for that, but still 18 years and above are the best candidate for the surgery. And we do examine and we check the local inflammation if there is that. There are certain conditions, autoimmune diseases, immune deficiency syndromes in
But
which
generally,
it
a
is
fit and healthy person is completely entitled to do it. And following it, are there any precautions? Can the person getting the LASIK surgery drive himself back home?
Okay. The first thing you ask that if you walk in and we can do like that. No, it doesn't happen just like that, because we have to ask first that whether patient is wearing contact lenses or no. He has to remove contact lenses for 5-7 days, and then there is a thorough examination. We do the topography of the cornea. It's a mapping of the cornea which tells us that whether patient is having keratoconus or no, how the irregularities are. We check the thickness of the cornea also, and the last but not least is a retinal examination. Most of the 7% population, they do have some problems in the retina which need to be addressed before surgery. And your second question, that whether he will be able to drive home, we usually ask them to ask somebody to drive you home, because it's not a good idea to have to drive on the same day or first or second day for after the surgery, because of little bit transient blurring of the vision. It is not a good idea to drive.
Okay, thank you so much, Dr. Mohammad Aslam Jan, for joining us today and discussing this important subject of eyesight and LASIK operations as well. We thank you for being with us here today, and we'll take now a short break, our dear viewers, and we'll be right back with the Saudi segment.